A disability is something that has a major impact on your life.
Every disability is different.
And it's never the same thing for two people. I am blind in my right eye totally and partially sighted in my left eye.
I was 18 years old. We were traveling way too fast on a gravel road. Broke my neck, my back.
My Asperger's syndrome and my cerebral palsy.
I have anxiety and depression. People would have no idea just talking to me.
Being independent means different things to different people.
I want to live in my own house. I want to pay my own bills.
Live independently and not rely on other people.
When someone is not able to live as independently as they can, it does have a detrimental effect on people's physical and mental well-being.
It's no complicated thing. It's just that people with disabilities want to be included.
Plenty of people get stuck in ruts when they feel like they can't overcome something in their life. That's where Lift comes in.
Living independently for today and tomorrow. Lift. We help people of all ages and all types of disabilities find the resources or acquire the skills to live as independently as possible.
We serve the southeastern 18 counties here at the Billings office. We have a variety of things that we offer. We can help with grant funding for adaptive equipment.
Maybe a home modification so they're able to access their home. We help people to find that funding.
Helping people apply for Social Security benefits.
Medicaid, Medicare, housing.
They have a peer support group. Peer support, I think, is key.
Sharing life experiences is one of the most powerful things to help people who might be new to disability, who might be struggling with their disability.
Youth transitions is kids that are transitioning out of high school. They need to learn those adulting skills. It might be rent an apartment, learn how to grocery shop, budgeting.
Help someone advocate for themselves in a school or an employment setting. One of our biggest strengths is providing folks with information and referral. If we can't help you, we hope to know who can.
A lot of times we'll have a potential consumer call in and they think that they just have one need, and it turns out that we end up finding 3 or 4 things we can actually do for them.
You can just come in and say, hey, I feel like I have this going on. Can you help me? And we can, which is so cool to me. I love that.
Most of us on staff at Lift have identified ourselves as having one or more disabilities. That is helpful in many cases.
It's easier to empathize with someone when you yourself have struggled with a disability.
This is what we specialize in. This is who we are, and this is what we do.
And it costs nothing to go to Lift. It's a nonprofit organization and they're there to help.
Somebody that was a consumer that was working with Lift was asked to do an art project. He visualized that the balloon helps to lift people up. And then it became the logo, and it's stuck.
There's been success on all kinds of levels.
It's really rewarding to have a consumer go, hey, I was able to do this by myself today.
We want people to live their best life as independent as possible.
Live as everyone else in society and live as a part of society, not apart from society.
Everybody needs help. Sometimes you just need a little more help, and that's okay. That's absolutely okay.
There's plenty of life to live still, and there's a way you can do it. Keep chipping away at it, little by little by little.
Knowledge is power. Let's share it, for crying out loud.
Send us an email, give us a call. We'll do our best to help.
We can definitely help figure out what your needs are and get started on that. We're one of many steps in the path to independence, and we're happy to be serving people here in the community.
Good day and welcome to another edition of Living Well in Montana. My name is Jed Barton. Living Well in Montana is a program of living independently for today and tomorrow, or colloquially known as LIFT. LIFT is a nonprofit center for independent living, providing people with disabilities with advocacy and resources that help empower them to break down the physical, bureaucratic, and cultural barriers that prevent them from being fully independent participants in their lives and communities. We serve 18 counties in southeastern and south central Montana. For more about LIFT's programs and services, please visit our website, lift.org, or download our mobile app for your Apple or Android device. Often, when LIFT team members are out in the communities making a presentation, we use a line similar to the following: disability knows no boundary of age, race, ethnicity, religion, sexual orientation, gender identity, political affiliation, or economic class. Anyone can acquire a disability at some point in their life. No one is immune. That means that disability intersects with all of the various varieties and permutations of human life, and today's program will be discussing one of those intersections, the intersection of disability and persons within the LGBTQ plus community. Joining the conversation are LIFT independent living specialist Theo Wheeler and the Reverend Dwight Welch of United Campus Ministries at Montana State University Billings. Both Theo and Reverend Welch are persons with disabilities and members of various sections of the LGBTQ community, and will be providing their perspective on the issues we discuss. Thank you for joining us, Theo and Dwight.
Happy to be here.
Yeah, definitely.
So if we'll start with Theo. I think, Theo, this is your second time on the program, and you may have covered some of this in your initial appearance. But could you tell folks a little bit about your journey?
Yeah, so hi, my name's Theo. I'm 19, about to turn 20, and I am visually impaired and autistic, and I am also non-binary. And I found that having an intersectional identity has helped me to have an open mind to complex situations and identities that I'm not necessarily a part of, and it really helps me connect with other people.
And Dwight, sort of the same question for you.
Sure. So I am gay and autistic, but back in the 80s, we didn't have that language or terminology. So I was just gay and odd, and a perpetual puzzle to school counselors. And it wasn't until I was in seminary doing clinical pastoral education. Well, I'll mention this. That's when the autism came out, or at that point it was called Asperger's. And I had a supervisor ask if I did have Asperger's. And so I did a ton of research and kept on reading descriptions that just fit perfectly for that. And it's what I was going to mention is that it's an odd thing because I've been out and proud as a gay man for like 30 whatever years. But my autism was something that I thought, oh, I got to hide that. You can't do ministry and be autistic. This just isn't going to work. And the first day on the job at one of my first churches, I had a clinical trial psychologist who's like, are you autistic? Not as an insult, just as a genuine query. And it was like, oh, yeah, I can't hide this. And then later, I come to believe that just like being gay, being autistic can be a strength and a way of relating to other people. So I find kind of similar thing that this opens doors to connecting with people. And I lead with both.
Right. And in addition to your duties as the called campus pastor for United Campus Ministry, you also are the faculty advisor for an autism club and a LGBTQ club on campus, correct?
Yes. So to clarify, the OUT is its own student organization, and I serve as its advisor for the LGBT community at MSUB.
Okay.
Autism Club remains a program that's under the umbrella of United Campus Ministry. So they're not their own group per se, but
Okay.
they have kind of defined everything we do at UCM. My autistic students are involved in every feature of UCM, including the Autism Club.
Okay. Neat. So you talked about, Dwight, your experiences as a person being educated in an era where there wasn't necessarily a term or it wasn't well known. I was educated in an era. I am one of, again, about the same time you started your first pastoral job and found out about Asperger's. I was in the 5th grade and heard the word Asperger's. And so Theo, you're let's see, I'm 39, so I'm 20 years older than you. So Theo, you've been educated largely in a time and place where both the without the autism and the LGBTQ plus have been out there a little more. I won't say accepted by everybody because that's still a dream, but out there a little more. Do you think there's a difference in the way that you approach things from the way that Dwight and I might?
I would say so, probably just because I have a kind of niche experience. Some people might not know that autism is, they have found that autism is genetic. And so both of my siblings are autistic, and I'm the middle child, and they were diagnosed in early childhood, but I wasn't diagnosed until I was about 14. And so I was very aware of autism, but I had no idea that applied to me. I just thought I was weird and, out there, and that, nobody liked me, and, all of these kind of really a lot of this internalized ableism, because I saw my autistic siblings and, they had a lot of supports, but it just, the way that my autism presented, it wasn't the way that during the 2010s was considered to be autistic traits. It was just quirky. And so I did appreciate that once I kind of came to the realization that I was autistic, I was able to go online and find a whole slew of resources and research and information to help support myself in the realization that I'm autistic. But it is, for a lot of people, I've heard both that being diagnosed in early childhood is really hard and very isolating, and for adults who are diagnosed later in life, that is hard and isolating. And so I think that everybody's experience with it is a little bit different, but I would say that I appreciate coming to that realization in a time where there are resources to access.
So, yeah, because Dwight, you talked about being educated in a time where you were just considered a little bit odd, and there was certainly a little bit of that for me, and it sounds like there was even a little bit of that for Theo. Regarding the LGBTQ plus community itself, and this is a sticky wicket, as one might say, but as you've discovered your identity within that community, and this question is for either of you, is there a level of ableism within the LGBTQ plus community that may exist, or?
Well, I'll throw out an idea. My on the one hand, my working assumption is it must be, because it's pervasive in our society, right?
Right.
But I do suspect that the LGBT community that I've been a part of, in every community, is much more diverse than what you might see in media representations, right?
Right.
And so, yeah, the LGBT community that I've always interacted with, and I've lived throughout the Midwest and Rocky Mountain West, has been where disability is part of that community, and autistic people are part of that community, and different socioeconomic and different racial backgrounds. It's but yeah, that doesn't get portrayed, and or maybe even marketed to. The other kind of feature with that is
Right.
there is kind of a class issue, which is it's particular for trans people. They're not going to get marketed to because economically they are kind of left behind. And so, what is how the media seeks to bring in the LGBT community? It often doesn't reflect the diversity of economics, disability, and race
Sure.
that is afoot.
Yeah,
Right.
along with what Dwight said, I think that in most community spaces, there is going to be some of those systemic issues we have now, just because it's systemic and it is pervasive in our entire society. But I do agree that just because of the general idea when it comes to the LGBTQ plus community of acceptance and support and supporting your peers and other members of your community, I would say that it is a little less pervasive at the very least from some other communities necessarily.
Okay. Yeah, we're not that far in the grand scheme of history removed from being gay or lesbian or otherwise being classified alongside mental illnesses, mental disabilities. And so I've always, as somebody who's not a member of the LGBTQ community, but is a member of the disability community, and again, I have autism spectrum disorder and cerebral palsy, and I know that that means my brain and my body work differently than most, and I realize that being LGBTQ is a little bit like that, but not in terms of, and so it's always been interesting to me because I've grown up in a relatively progressive situation, even in relatively traditionally non-progressive places, and I've known folks in both the disability and LGBTQ communities all my life. And so moving on from that, and Dwight, you mentioned marketing to the LGBTQ community, and we hope we're not being that crass, but one of the projects we have ongoing at LIFT right now is encouraging people, particularly people with disabilities, to receive their vaccinations, not just the COVID-19 vaccination but the flu vaccination and other vaccinations. And we're setting up a series of clinics here in the near future for folks to be able to access vaccinations. And for more information on that, you can contact LIFT at 259-5181, or keep your eyes on lift.org or our various social media platforms. But one of the things that we've been educated on through the U.S. through working with U.S. Aging, which is that it's not just the aging and disability community that needs to get vaccinated. It's obviously everybody who wants to. Again, we're big into that in the independent living movement, that everybody needs to make the best choice for themselves. But one of the things we've been learning about is that the LGBTQ plus community can feel excluded or left behind in medical efforts, public health efforts, vaccination included. And one of the things I was wondering is, again, and obviously asking people to make blanket statements for entire communities is not a good idea, but what, as LGBTQ plus folks living in LIFT's region, would you say we should do to be mindful of our potential LGBTQ plus consumers, whether they're participating in the vaccination program or other services?
Oh, I was just gonna say initially, I mean, one of the challenges it kind of highlighted, especially for trans and gender non-binary folks, and the folks who have reported issues with the healthcare system or being accepted by their name or not having assumptions placed on them on their particular experiences because they're either trans or non-binary has been a significant challenge, I think, for that community. And like other marginalized groups, accessing the healthcare system is going to be those stories are going to be pervasive, or they're going to form how people think about and relate to the medical community. And so, in some measure, to do kind of an outreach campaign that's going to be mindful of, I don't know if vaccines kind of bring those questions to the fore, but to like if you're filling out a form to get a vaccine, to have different kind of gender identification markers or maybe pronouns, and we at Out we share all of our pronouns. There also could be privacy concerns, especially if somebody is underage and LGBT and what they want to have revealed or not. And so medical care, being able to protect privacy concerns, could also gender trust, I mean, I have a friend who's a chaplain at Billings Clinic, and he's literally got a little rainbow thing, on his lapel, just because it's a public signal that this is a safe place. And I think those end up becoming important too.
Yeah, I agree with Dwight that sometimes just subtle ways of showing that you're inclusive and accepting can be very monumental to members of the community. I know that if I'm going by a business or if I'm at the doctor's office and I see a little pride sticker, even if it's a tiny one in the corner, I'll feel a lot better about receiving my medical care there or taking my business there, because I know that they're going to be kind to me and be accepting and understanding. And so I think just prioritizing people's needs and well-being and health over necessarily let's see how we want to phrase this. Being kind and accepting and welcoming should be everyone's main priority. And I think that will help a lot when it comes to people receiving the medical care that they need and the community support that they need and the social support that they need.
Great. Last 4 minutes or so here. Are there any thoughts or ideas that each of you would like to leave our viewers with today? Get about a minute each.
Well, I will say that being autistic, just like being LGBT, is lifelong. And so if you work or relate or think about kind of autistic children, know that they become adults with their own kind of sets of needs and gifts and challenges. And I think the wider conversation, which certainly includes the LGBT community and autistic adults, is one that'll be important in the next number of years to kind of work on for the Billings community as well as for a lot of communities.
You?
I would say that I would like to leave our viewers with the thought of conscious kindness and understanding. I know I kind of harp on that a lot, but for a lot of people, the main barrier when it comes to receiving services or even reaching out for services is a fear of stigma and even internalized stigma when it comes to needing services and medical help, because asking for help is not easy. And, a lot of people in Montana, we have our pride, kind of bootstraps attitude, but it's important that people, when they ask for help, when they ask for medical care, to be given what they need and not made to feel like there's some sort of burden or that they shouldn't ask for something that they need, such as vaccinations or support services or community supports. And I would say to anyone who's trying to build up the courage to ask for help like that, that you are not alone, and that a lot of people go through what you're going through, and that help is here if you look for it and you ask for it.
Wonderful. Thank you, Theo and Dwight. Thank you for joining us. And this has been Living Well in Montana, a service of living independently for today and tomorrow. To find out more about LIFT, you can visit us online at www.liftt.org, or give us a call at our Billings office at 406-259-5181, or at our Glendive office at 406-948-8500. My name is Jed Barton, and thank you for watching.